Dear students, let us start learning various case-based descriptive or essay questions, scenario-based MCQs, and reasoning questions that can be asked in physiology with the explanation. Let us begin with a case scenario. A 24-year-old pregnant woman, Mrs. VD, visits a doctor complaining of excessive tiredness, lethargic, and dizziness since 2 months. Examination shows pallor, chylomicria, and ulcers in the tongue. Pallor means paleness of skin and mucous membrane. The common areas of pallor examination are lower palpebral conjunctiva, palm, tongue, and lips. Here is an image which is showing pallor in lower palpebral conjunctiva. And chylomicria meaning spoon-shaped nails. Here is an image showing chylomicria. Investigation reveals HB 7 gram percentage, MCV 65 femtoliters, MCH 25 picograms and MCHC 25 grams per deciliter. For the given scenario, what are the scenario-based descriptive questions that can be asked? What is the possible diagnosis? The possible diagnosis is iron deficiency anemia. What is the physiological basis for anemia in iron deficiency? So we know that iron is required for hemoglobin synthesis. So due to the deficiency of iron, there is reduced hemoglobin formation, and we all know that hemoglobin is the one which carries oxygen in the blood as oxyhemoglobin. Reduced hemoglobin leads to reduced oxygen carrying capacity of the blood, leading to anemia. What are the common causes for iron deficiency anemia? The common causes like dietary deficiency of iron, or iron is not getting properly absorbed. Conditions like excessive menstrual bleeding, also called menorrhagia, hemorrhoids or chronic peptic ulcer, where we see chronic bleeding leading to increased iron loss, or increased demand for iron, for example like pregnancy or lactation. So these all conditions can lead to iron deficiency. What is the basis for giddiness seen in anemia? So as we already explained, in case of anemia, there is reduced oxygen carrying capacity of the blood, leading to reduced oxygen supply to various tissues. This can lead to various symptoms like giddiness, dizziness, lethargic, tiredness, breathlessness. Sometimes as in compensatory mechanisms, we also can see increased heart rate called as tachycardia. What type of blood picture is seen in peripheral smear in case of iron deficiency anemia? So we see microcytes and hypochromic RBCs. So the reasoning question that can be asked is why microcytic and hypochromic RBCs are seen in patients with iron deficiency anemia. So hemoglobin formed will be inadequate inside each RBCs because of iron deficiency. So due to the less filling of hemoglobin inside each RBCs, this makes the RBCs to become small sized called microcytes and to look pale, that those are called hypochromic. What are the laboratory findings seen in iron deficiency anemia? Hemoglobin will be reduced. Various red blood cell indices like mean corpuscular volume. It is the average volume of each RBC. Normal value is 80 to 100 femtoliters. And here, because we see microcytes, MCV will be reduced. Mean corpuscular hemoglobin, normal value is 27 to 33 micrograms, will be reduced. Mean corpuscular hemoglobin concentration, normal value is 30 to 38 grams per deciliter, will be reduced. Serum iron level will be reduced, whereas serum total iron binding capacity will be increased. So what are the scenario-based MCQs that can come in above condition? What is the morphological feature of RBCs seen in iron deficiency anemia? I hope all of you know the answer already. All of the following are seen in iron deficiency anemia except. Yes, the answer is reduced total iron binding capacity, because in case of iron deficiency anemia we see total iron binding capacity will be increased. Some of the reasoning questions that can be already asked, I already discussed one. What is the basis for tiredness or giddiness or any features which we discussed can be asked as a reasoning question. What is the basis of microcytes and hypochromic RBC seen in iron deficiency anemia can also be reasoning question. Thank you for the careful listening.